This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch WisconsinEye on Spectrum Channels 995 and 363 and at wiseye.org.
Welcome back. Health policy at all levels are critical drivers to changes in health behaviors. We're fortunate to have not one, but two expert speakers today who will help us better understand tobacco policy in Wisconsin. Carleigh Olson is the Policy Training and Technical Assistance Coordinator, a collaborative position between the Wisconsin Division of Public Health Tobacco Prevention and Control Program and the Match Group. Carleigh completed her Master's in Public Health from the University of Wisconsin-Madison and a Bachelor's of Science from the University of Wisconsin-La Crosse in Community Health Education and Spanish. Carleigh has served in a number of different roles, including Community Health Educator for the Eau Claire City County Health Department and as a Program Coordinator for Public Health, Madison and Dane County. Through her roles, she has coordinated and facilitated local substance misuse prevention coalitions, conducted a health impact assessment of the built environment, fostered Board of Health engagement, and fueled national accreditation processes. Darcie Warren coordinates the Partnership for a Tobacco-Free Wisconsin Coalition and offers training and technical assistance to local tobacco control partners regarding policy development and coalition building. Darcie studied political science at the University of Wisconsin-Madison, completed a Master's of Public Administration degree at UW-Milwaukee. Preceding her current position, Darcie led student services, recruitment, and academic affairs at UW-Milwaukee's Joseph J. Zilber School of Public Health. She helped start up the school from scratch and supported their successful initial accreditation efforts. Prior to working with UW-Milwaukee, Darcie worked as a public health educator in the Wisconsin Division of Public Health Southeast Region Milwaukee office as the statewide organizer for the Campaign for Smoke-Free Workplaces in Wisconsin. Darcie started her career organizing healthcare workers throughout Ohio, West Virginia, and Kentucky. Please join me in welcoming Carleigh and Darcie today.
Okay, hello everyone. I'm Carleigh. This is Darcie. Just so you know who we are. But okay, so we're gonna just jump right in and talk a bit about tobacco policy. So Darcie and I work collaboratively together in providing technical assistance to local coalitions all over the state. So that's kind of how we get tied together, just so that's clear. And we clearly planned our outfits in our blazer twins, so. Okay, oh yeah.
I just wanted to mention I work with American Lung Association, and my role is twofold. So half is to work with Carleigh to provide training and technical assistance for partners that are funded by the Tobacco Prevention and Control Program across the state to be policy ready. And the other half is to coordinate the statewide tobacco prevention coalition, which is called Partnership for a Tobacco-Free Wisconsin. And I have a separate presentation later about that coalition.
Thank you, Darcie. Okay, so what we're going to talk through today, we're going to talk a little bit about the current infrastructure in Wisconsin for tobacco prevention and control, where the coalitions and networks are. I think it's just really helpful to have that lens when we talk about policy and what things really look like right now. Then we're going to talk about preemption. Kind of a fancy word. Has anyone heard of preemption? Do you know what that word means? A few people. Yeah, so we'll get us all on the same page on that. Super, super important when we talk about tobacco policy. It is what guides what we can and cannot do at the local level. Then we're going to talk about what's going on with local initiatives and what's happening in the local environment, and then also talk about what's happening in the statewide environment. So that's kind of what we're going to work through. Okay, so infrastructure. Right now we've got 15 tobacco prevention coalitions. We call them multi-jurisdictional coalitions, or MJCs. So if I say that, that's what I mean. Jenna, I'm not sure if she's still here, but she represents an MJC. The 15 coalitions are represented in this map here, and I have maps out on the table if you're curious about who your contact might be if it's not Jenna. And these coalitions work on lots and lots of different things. They're situated to cover many areas, and you can kind of see how they're represented here. You also can see that there are areas that are uncovered, and that is a challenge, and we hope that someday we'll have full statewide coverage, but you can see that there are some spots that we don't have coverage. So that's kind of the coalition structure right now. In addition to the 15 coalitions, we have 5 disparity networks, and there are maps of these also out on the table. The disparity networks are focused in on where we know that there are tobacco disparities. So we've got the Poverty Network, the Asian American Network, the African American Network, the Hispanic Latino Network, and the Native American Network, all working specifically within those populations on tobacco prevention and control. So that's kind of how we're set up. So in total, that's 20 funded people from the tobacco prevention, or 20 funded coalitions or networks from the Tobacco Prevention and Control Program. Okay, so I want to talk a little bit about some other things that the Tobacco Prevention and Control Program works on. So Wisconsin WINS, some of you may have heard of this program. It's located in all 72 counties, and compliance checks are done with youth to try to prevent the sale of products to minors. And we have up here the sale rate in Marathon County, so that means 8.9% of the checks were sold to a minor. The statewide rate is 5.8, so you can see that there is slight difference there for Marathon County. Wisconsin WINS has a whole website where you can look up different counties and how many checks were done, what the percentage of sale rate was, if you're curious or if you want to kind of see where your county might compare. So that's a program that's run out of the department and really important in creating awareness to not sell to people who are under 18. So kind of good information to have. Another area that the program really works on and provides funding to one of our statewide partners is the Wisconsin Women's Health Foundation. So we know that our Wisconsin pregnant mom smoking rate is much higher than the statewide or the national average. So this is a particular area of priority here. So the First Breath program works with pregnant moms and their families to quit smoking, and the data is about 1/3 of the people who participate in the program still remain quit after participating. So pretty great. We know that that is a high-risk population, and we obviously want that to go down. So that is a program that we support and fund. And then you'll hear more about the Quit Line later when Alex talks, but this is also a program that is funded through the Tobacco Prevention and Control Program. The Quit Line is super important, right? When we talk about policy and making policy change, we know that that impacts people, and if they want to they choose to quit, then we want to be sure to have those resources for them. So the Quit Line is administered through UW-CTRI, and I won't steal Alex's thunder, but she'll talk a lot more about that later. Okay, so another really interesting project that comes out of the program, which you are welcome to ask questions on if you want, but is the Wisconsin Retail Assessment Project. So with this project, we really wanted to find out, what's going on in the retail environment. I don't know if anyone is like me, but I pay at the pump, and I really pretty much have no awareness of what goes on inside a gas station or a convenience store. And so this project really looks to understand what's going on with advertisement, product placement, are there things in front of the counter, behind the counter? What does it look like in the retail environment? And so people with the RAP project go out into the community and participate in an assessment process, gather that data, and then we're able to analyze it to figure out what's going on. So it's a really pretty remarkable program, and we've gathered great data about it. I think particularly interesting is in the Milwaukee area, they had done a cluster analysis of what was going on in the Milwaukee area and found that certain products were more strategically marketed to certain communities of color or low-income communities different from other communities. So proving really what we already knew, right? That like certain people are targeted by the tobacco industry, but now it gives us that local data to be able to support that of what's going on in the Milwaukee area and then also larger in our state. Okay, so I just want to take a moment to talk about HUD housing and just kind of let you know what's going on in the housing front. So not a lot of people know that the HUD ruling went into effect, meaning that all HUD housing or federally owned housing is now smoke-free. That does not include e-cigarettes, but it protects 18,000 Wisconsin residents from secondhand smoke. So that announcement came out in 2006, and then all HUD units were supposed to be smoke-free by July 30th of 2018. So the ALA hosted a big press conference about this in the summer, and it was pretty exciting. I think where people get confused with this is HUD housing is not Section 8 housing. And Section 8 housing can be, you know, a mix of federally subsidized, but also privately owned. And so that can get confusing for people. So it's important to know that the rule only impacts people who live in completely federally owned housing. But really quite remarkable, right? That's protecting a lot of people when we know that people who live in HUD housing smoke at a much higher rate than our statewide average. So pretty exciting, and you know, we're really still in the implementation phase of this, but we hope to see a lot more progress.
So I'm going to start by talking a bit more about the unique partnership that the Wisconsin Tobacco Prevention and Control Program has with the American Lung Association, where I work. So as Carleigh just mentioned, there was a big press conference that American Lung Association did in Milwaukee related to this HUD housing implementation. Many of the people who live in HUD housing were offered a program called Freedom from Smoking, which is an American Lung Association cessation in-person sort of group cessation quit program that this special population sometimes needs more support to quit than what the Quit Line is able to offer with the limited funding that it receives. And so American Lung Association is the program that Doris Harding is talking about that was able to support her in quitting smoking after all those years. American Lung Association also administers a program called SPARK at colleges and universities. So colleges and universities in Wisconsin have followed the national trend in more and more going tobacco-free. From 2011 to 2017, the number of smoke-free and tobacco-free campuses more than doubled across the United States. And currently, Wisconsin has 29 completely tobacco-free campuses. I'm going to play a short video. Can you bring it up as I talk? Thank you. So, American Lung Association also partners with the Wisconsin Tobacco Prevention and Control Program on a program called FACT. And we're going to hear from some of the youth participating in that program later today. It's a peer-to-peer tobacco prevention program, and this is one of the youth that participates in that program, and she talks about what it's meant to her to be a part of FACT.
Oh my gosh, my mom is my everything. She's the most amazing woman I've ever met. I can talk to her about anything, and we do everything together.
Hi Mom, I'm home.
I wouldn't have it any other way. I love every second of being with her.
Hey, how's your day?
Good. How was yours?
That was pretty good.
Allie was part of the FACT program, I believe, since 4th grade.
That was like one of the best decisions I've ever made in my life, to be honest, because I've had so many opportunities from it, and without it, I wouldn't be the person I am today. But I don't think that I really had a connection to it, like heart to heart. It was just kind of a fun activity that we did during recess. But then when I found out that my mom had lung cancer, I think that's what really propelled my work in it, and it really made me have a reason for doing it. I was anticipating it, and I didn't know what was going to happen. She was gone for quite a while, so that made me a little nervous, and I kind of had this hunch feeling that it wasn't going to be great. And I remember them walking through the door and she had tears in her eyes, and I knew that it wasn't going to be an easy road, but yeah, it wasn't easy, and we cried for a long time. She hugged me. That was the biggest hug ever. But I knew she was going to be okay.
I don't even know. It's just devastation. Like, wow, I'm 47. Can this really be happening to me? I have so much more to live for. It's hard.
My first thoughts was I didn't want to live life without her.
Fear of the unknown, what's ahead. It's hard.
Yeah, and your time to plan goes so slow. Just be there for them, whatever they need. If they just need to talk about it, if you need to go to their appointment. I had some of the best times with my mom when we were at her appointments, just like playing cards or eating. Like, it doesn't seem like a chore. It just seems like helping her out and being her daughter. That's what it's all about.
You really learn a lot about yourself through this. You learn what's really important in life. Not to sweat the small things.
And it's been the ability to go through life knowing that you're going to get knocked down, knowing that you're going to have hard days, and that just comes with life. Like, nobody's life is perfect. Nobody's going to go through life with everything handed to them. So it makes you a stronger person if you go into it with a mindset that, God gave you the biggest battles to its hardest warriors.
I've learned a lot about Allie. She's a strong girl and a go-getter. She's going to make a difference in this world.
My most memorable moment was for sure the Joint Finance Committee when I was a little freshman and I went up in front of 12 state chairmen and I talked to them about my story, and I was the only youth to participate. And the chairman, after I was done, he said, "Nice job." That was kind of the climax of my fact career because it was the first time that I saw my voice go into motion, and ever since then it's been so much more.
My last treatment is a rather new one. I guess it's only been around for about 5 years. And I feel like it saved my life. April 11th, the day of my diagnosis and the day they told me I was in remission as well.
It's such a special day, and I think we'll probably make it special for the rest of our lives just because it's our whole journey right there, so yeah.
I guess my biggest advice to anyone that has a cancer diagnosis is really to try not to look ahead. Just try to take it day by day, moment by moment.
This is scary.
So obviously that's a very touching video about Allie and her mom. And I think that the reason why it touches me so much, and I can look across and see that it's touching many of you, is because whether it's heart disease or lung disease or other cancers, this has touched many of us in our families, right? And so we know that some of those things are from tobacco use and e-cigarettes coming on the scene and becoming so popular with our youth so quickly. This is still a very serious problem in Wisconsin. We're going to hear from many of the fact leaders later today, and this is one of them that's in the room. And you can see that Jackie says that vaping and juuling are really common in her school. Juuling especially has become more prominent in her school due to it being discreet. And she hates to see people using e-cigs just to look cool, because these people don't really know the consequences that they're doing to their health, right? Before I move on, so just to say, the FACT program, it teaches leadership, and it can impact many schools throughout the Wisconsin, but it's not in every school, right? Because resources are limited. So I am kind of moving on from how American Lung Association is involved in tobacco prevention and control in Wisconsin to talk more, not to get too into the weeds, but to talk more about a specific hurdle that we have here in Wisconsin that's called preemption. Carleigh asked earlier who knows what preemption is, and just a couple hands went up. So I'm going to go into detail about what we can and can't do related to local and state policies. And that's really what preemption means. It's when a higher level of government makes a law that specifically prohibits a lower level of government from taking action in a specific policy area. So that's when the federal government says state and local governments can't pass any policies related to this specific policy area. Or when the state government passes a law saying local cities, villages, and counties can't pass any policies related to this specific area. In tobacco prevention and control, this comes up all the time. And the reason for that is that there's a long history in tobacco prevention and control policy where there's a groundswell of grassroots support to pass local policies that are much stronger than state or federal laws because local folks are seeing this really impacting their communities. And then as those local areas pass these stronger policies, it trickles up. And then that's when the state actually takes action or the federal government actually takes action. But the tobacco industry knows this, right? So the tobacco industry is always working on trying to get decision makers at the federal and state levels to pass policies that include preemption so that localities can't pass stronger policies in specific areas. And I'm going to talk a little bit about the specific areas in Wisconsin that are preempted. As it's been mentioned already today, many of these kids are trying these products because they're fruit and candy flavored. And some of you may have heard some talk in Wisconsin or about a federal law related to tobacco 21. And what that means is increasing the age to buy tobacco from 18 to 21, right? This is already passed in Illinois. They're trying to pass it in Minnesota. And so we're getting a lot of questions about this. There was a bill introduced at the federal level to do this just in the last couple weeks. The strange thing about this federal bill is that some of the people who are authors on this bill have typically aligned with the tobacco industry. So it has our spidey sense tingling, what's going on with this bill. And so the American Lung Association, the American Heart Association, and the American Cancer Society have all said that if preemption of any kind is included in any of these bills, it's a deal breaker for us, right? And so there's been some talk about whether it's going to be a kind of a clean bill that just increases the age to 21, or whether it's going to be increase the age to 21 and no lower level of government can pass anything related to restricting flavors, right? Or something else. Just to mention, members of our statewide coalition, the Partnership for Tobacco-Free Wisconsin, have said that restricting flavors is something they'd like to do in the next 3 to 5 years. So they're seeing this Tobacco 21 pop up, and they would be very supportive of something like this if it was a clean bill that didn't include preemption, but it's something that we're definitely monitoring. In Wisconsin, all youth access point of sale is preempted expressly in law. So that would mean something like increasing the age to 21 cannot be done at the local level in Wisconsin. So e-cigarettes are not the only flavored tobacco products attracting kids. Little cigars and cigarillos are also a really big problem. And these are taxed by weight, not like cigarettes, they're taxed by pack. So little cigars are sometimes sold in packs of 1 or 2 or 3. It makes them extremely affordable for teens. Sometimes you can buy them for under $1. And taxing products, licensing retailers, and product placement, again, are related to youth access point of sale. So these are all expressly prohibited in Wisconsin law. The state could change those policies and tax products like e-cigarettes or increase taxes on little cigars and cigarillos. And in fact, the governor included in his budget a new tax on e-cigarettes and some cigars, the ones that are known as brown cigarettes. So the tax included in the governor's budget would only be the brown cigarettes with the filter, just like conventional white cigarettes that come in the packs of 20. It wouldn't impact the little cigars that are really, really affordable for teens in the packs of 1 or 2. And so our statewide coalition has an objective to increase all tobacco products taxes to 100% the manufacturer's price. So that would be a huge victory to stop kids from being able to get access to these products. It would be much more difficult for them to afford them. And just so that you know where it stands right now, and these things are moving really quickly, anything that's in the governor's budget, the Republican leadership of the state legislature is on record on this issue. Senator Darling has said no tobacco taxes or e-cigarette taxes will be in the budget, that it's not the place to increase taxes. Representative Nygren, who is her counterpart in the state assembly, has said a reasonable tax might be considered in the budget. So that's where that is right now. There's also a bill that's been introduced related to product placement. So you can see in this photograph that there are tobacco products with very flashy packaging and colors right next to some chips, right? And the Wisconsin Retail Assessment Project that Carleigh mentioned, we're seeing these problems all over the state in these assessments of tobacco retailers. Federal law says that cigarettes and chewing tobacco must be kept behind the counter, right? We've all seen that. We've gone into, grocery stores or, drug stores or any other convenience store, and someone has to ask for a can of chew, and the clerk has to assist them in buying it, right? They have to ask for whatever pack of cigarettes, and the clerk has to hand it to them. So this is another check for that clerk to say, oh, can I see your ID, right? There's a reason for that law. When that federal guideline went into place, all of these new tobacco products that are flavored and have, all of the e-cigarettes, they were just coming on the scene when that law went into place. So they're not included. So they don't need to be clerk-assisted sale. So this bill, SB 118, would change that. So that's not something that can be done on the local level with tobacco, but this would move all tobacco products and e-cigarettes where they would have to be behind the counter or in a locked case. So I'll go more in depth in my later presentation today about this, but I just want to mention it. So all of the programming that Carleigh and I just talked about, the programming that Jenna talked about earlier today, is funded by the Wisconsin Tobacco Prevention and Control Program. That program is funded at $5.3 million for the entire state. That is less than 1/10 of what the Centers for Disease Control recommends to adequately fund the programming in our state. So the Centers for Disease Control says $57.5 million is needed to address the problem of tobacco in Wisconsin, and right now we're funding $5.3 million. And I'll talk more about this later, but it's important to note that no cigarette taxes or other excise taxes on tobacco products are directed to this programming in our state, and also we don't have a master settlement money generation like some other states around us do. So that's not where this funding is coming from. It's just coming from the general state budget. Still, tobacco costs us $4.7 billion in lost productivity and healthcare costs every year. So the governor's budget that was proposed this year does include a modest increase in this programming, but we're not sure what the legislature's version of the budget will include. We in tobacco prevention and control know that to address these problems, it takes what we call a three-legged stool. So it takes funding adequately the tobacco prevention and control programming. It takes taxing and increasing the price of these products so that they're not accessible to youth. And it also takes things like clean indoor air that include e-cigarettes, so that when kids are out, they're not seeing other people, and it's not a social norm to be using these in public places. And there's also a bill in drafting in Wisconsin to do just that. And this is a really good example of how this has bubbled up from local action and grassroots change. In the last year, we've seen dozens of communities across Wisconsin choose to do what they can, because they look at what's preempted and what's not. And this is one of the things that locally you can change. So a lot of cities and villages have gone into their ordinances and changed their smoke-free workplaces ordinance to include vaping devices, so that, you know, these things aren't so prevalent when people are out. Because that normalizes them, that makes youth think that it's something that a lot of people do if they're seeing it in public places. I also want to touch on another kind of law that we're seeing a lot coming up locally, and we call it a youth access or punitive law. So this is something where I think it relates very much to what the officer was saying in the last presentation. We're seeing this as such a problem, and everyone is trying to just deal with it as it's coming up. And one of the ways, from a criminal justice perspective, that we're trying to deal with it is by passing laws that fine youth when they have the devices or the components. But we in public health believe that this is not the right route to go. That's after the problem has already occurred in that child, and directing it more towards treatment, and trying to kick the addiction instead of exacerbating what sometimes is, you know, problems in the family. If you're finding a family, that could also get the child in trouble at home, which sometimes there's bad dynamics at home. So this is just something to keep in mind. So now I'm going to turn it back over to Carleigh, who's going to talk about these kind of ordinances and other things that we're seeing locally.
Okay, so Darcie gave us a good overview of preemption and how that kind of dictates what can happen on a local level. We spend a lot of our time providing technical assistance to people who want to pass policy and work on ordinance and support people to change ordinances in their communities. And so I just want to talk a little bit about the areas that we provide support on. So she mentioned kind of this groundswell that's been happening with local ordinances to include vaping. So this has been a primary focus for a lot of communities, and we've been able to provide some best practice language to support them in definitions in creating ordinances that make it so that you cannot use an e-cigarette where you currently cannot smoke a cigarette. So that's been going on a lot, and we actually have a map where we map out all the different places that are working on this. So if you're curious and you want to know if your local community might have an ordinance, just come talk to us and I can look it up for you. I think one thing is we don't always know if a community is working on it, and so if you're like, oh, hang on, I know my local community has an ordinance and it's not on our map, let me know, because we'd love to add it. These best practice definitions are super important. It's not really as much what you call it, so e-cigarette, electronic device, vape device, it's how you define it. So you want the definition to be broad enough so it covers all of these emerging products that we're seeing, so that next year when there's the new drop or the new Soren that comes out, you don't have to go back and change the ordinance language so that that is not an exception, right? Another important thing with these definitions is that it also covers marijuana. And so we're really, the the legal advice and legal technical assistance that we get from the Tobacco Legal Consortium out of Minnesota really is trying to help us look ahead so that, again, if this is something that we're confronting 5-10 years from now, local municipalities don't have to go back and try to rework that, and so that it's just clean and is supportive of clean air, right? So another area that communities may work on is tobacco-free outdoor spaces. So outdoor space is a really general term. What that means is like parks, festivals, trails, those kinds of things. I think an important thing with this, and Darcie kind of touched on it a little bit with thinking about modeling and what our young people see. We've seen some communities do like a tobacco-free park 25 feet from a child care area or when children are present. And that's really hard to enforce. I mean, I don't know about you, but I definitely don't know how much 25 feet is. Maybe that's common knowledge, but I don't have it. So, that would be really hard for me. And so, best practice definitions and a best practice ordinance would say that the entire place that you're talking about is tobacco-free, not just one area. And then, a big area that all of the coalitions have been working on is tobacco-free schools. And obviously, with evidence of those who are in the room, and we've been talking about it all day, schools are, where this is happening and where people are really dealing with this. And so we've gotten some best practice policy language from that legal support that we get on tobacco-free schools. And so we have a model policy that if this would be, helpful for you, let us know. I'm happy to send it to you. But essentially, it's just making it so that your school policy is strong and basically states like you can't have any of these in our school, and regardless of if it has nicotine or not, regardless of if it even looks like a product, maybe it's a new emerging product and you don't know if it is or not. Even down to we've seen products that diffuse essential oils, and so teens say that they can have those. If it looks like it, if it has nicotine or not, you can't have it. That's basically what the policy states. I think a really important component with this model language that we have is that, it's non-punitive. And, speaking off of what Darcie was saying earlier about these youth possession policies that are popping up, we realize that, in order for a young person to get off of these products, they need support. They don't need to be expelled from school. And so the policy really helps outline some procedure around that of how, one way that you could support a youth in quitting or, getting them extra support if they're not quite ready for that, or, however that may look. So within the policy, there are different tiers of enforcement to help you outline what that might look like. So with that, I guess we can open it up for questions, and we'll go from there.
Any questions?
Yes, I can speak into a voice. What are you seeing are the biggest mistakes in policy development at a local level right now, as people are forging ahead with trying to respond with policy as the most effective way? What are you seeing are some of the big tripping points?
Well, I think any movement in this area, I would never call a mistake, first of all. But I get what you're saying. And we highlighted the youth access policies that we're seeing. So these are sometimes coming from very well-meaning law enforcement that's seeing this as a huge problem. And, that's what they do, right? What they do is try to figure out how can we try to control this issue that we're seeing coming up with our youth. Again, the public health perspective on that would be it's never to fine youth or punish youth. So that's definitely one I want to highlight. The other is just there is so much movement going on in this area that sometimes communities are getting in front of even asking for advice or technical assistance and putting things in that are preempted. before they realize that we have preemption in certain areas in our state. So definitely, checking in as early as you can with the Tobacco Prevention and Control Program and Carleigh or American Lung Association and me. We have those contacts with the Tobacco Control Legal Consortium to ask about those fine details of preemption. I would say those two. Do you want to add anything, Carleigh?
Yeah, and I mean, I kind of touched on this a little bit. I think definitions are important, and making sure that you're really, really clear about what you mean. And so, we've seen some policies come through that, maybe don't define an e-cigarette, or they don't define what smoking means, and that smoking includes e-cigarette, right? And so making sure that the definitions are best practice public health definitions so that you catch all of those things so you don't have to go back. I mean, we know policy takes a long time, right? It takes a long time and a lot of effort. And so you definitely don't want to have to go back to the drawing board if you're, needing to change something. So you want to be able to do it right the first time.
And I think just to reiterate that, because I think that's very, very true, is a huge example of that is the fact that chewing tobacco and cigarettes have to be behind the counter. The tobacco industry is motivated to make profit, and with the smoke-free workplaces, all of the research on secondhand smoke leading to so many states doing smoke-free workplaces, now they have, devices that don't count in that, right? With the tobacco products behind the counter, now there's all sorts of tobacco products to attract youth that are flavored that don't count in that. And so making sure that we rely on that legal consortium definition is really important. Yeah.
Of schools, sure. In terms of school policy, and kind of the flip side of his question is, what recourse are schools using to enforce their policies without being punitive to the students?
Thank you. So do you mean like what are they doing that would be non-punitive? Yeah. So I've honestly heard of, so this is what I've learned from school personnel, is that a lot of times the enforcement mechanism follows every other enforcement mechanism. So whether you, these maybe are bad examples, but maybe you skip class, maybe you, have some other product on campus, it's all following the same enforcement mechanism versus recognizing that if somebody's caught with an e-cigarette, probably they're addicted, right? And so giving them the support they need in order to change that behavior. So within the model policy, it outlines some other ways like getting parental support, getting counseling, and I think one of the, and I think that Alex will talk about this a little bit later, but one of the really hard things with this is that there's not a lot of great youth cessation resources. I mean, there are some, but it's an emerging area because, we know nicotine is addictive to the brain, so that's obviously a huge ethical issue in studying cessation in youth. When you think about how we would go about that, there's a lot of just like with human subjects research, that's pretty challenging. So, I think it's hard, but trying to get it so that they get the support they need versus fining or, giving them an expulsion or whatever that looks like. But I recognize that that might mean that it goes against what other enforcement mechanisms look like in school policy. And from the communities I've talked with, that's been a pretty tough conversation. So do you want to add anything?
I do. Just that the American Lung Association has a pilot project right now called In Depth that is a youth cessation program that would include vaping and e-cigarettes. And 2 of its pilot schools are in Wisconsin. And it will be rolling out this summer for implementation in the fall. And just like anything else, funding is always a really big barrier to supporting that kind of work. Yes.
So along that lines, I know that local governments are really taxed with how they can generate revenue and stretched thin. Have you come across any local policies, ordinances that help generate revenue that can be used to offset prevention efforts, specifically with youth, in this case, vaping to help fund local initiatives since the state isn't in that position?
That is so hard. Across the state, we've seen different things, but it doesn't generate the amount of revenue that's necessary. So increasing the tobacco retailer license to the state maximum that's allowed, $100, and then directing or earmarking that funding to prevention, that's gonna add up, but not to the level that it needs to address this problem. There are specific counties in the state that actually have passed through referendum tax levies that support their health departments, just like school systems sometimes do, but that is also very rare. Thank you so much.
Nice job.
Thank you so much, Carleigh and Darcie, for that overview, all that preemption information, and some great examples of what local communities can do. As Jenna mentioned in the first presentation today, tobacco products have a very long history of using marketing to build a desirable culture around tobacco use. Spencer Straub is the Media and Communications Coordinator for Wisconsin's Tobacco Prevention and Control Program. In that position, Spencer directs the Tobacco Prevention and Control Program's paid and earned media efforts, including the Tobacco is Changing campaign. Spencer also provides communications technical assistance and tools to partners. He has served on advisory committees for the CDC Media Network and the CDC Media Campaign Resource Center. In his time with the Tobacco Prevention and Control Program, Spencer has led media trainings and overseen branding efforts, statewide media campaigns, collateral development, and market research projects. Welcome, Spencer, to tell us about the campaign. That's you? Okay, good. Fantastic.
Good morning, everyone. I'm really excited to be here to talk about the Tobacco is Changing campaign. As we have talked about with several speakers now, this is just the reality of what we're facing. And so I will go through a little bit of the process of the development of the campaign, and then also how the campaign has evolved and changed to meet the changing nature of tobacco. So we know right now that this is the reality of the tobacco product landscape that today's kids are dealing with. Products come in all shapes, sizes, and flavors, and educating about other tobacco products has long been part of Wisconsin's comprehensive tobacco prevention and control efforts. But for years, even before Juul became such a big thing, we kept hearing from coalitions that they really needed some of that air cover that a media campaign could provide. And our goal was to really develop a campaign that could focus our education efforts and provide some kind of rallying cry for our statewide movement. And so we know that while smoking is down among Wisconsin youth, e-cigarette use is way up. It jumped from 8% among Wisconsin high school students in 2014 to 20.1% in 2018. And as we've been talking about throughout the different presentations, one of the main reasons for the product's popularity are flavors like the ones shown here. So with e-cigarette rates going up and new tobacco products filling the shelves, in 2017 we decided it was time to address the issue through a new media campaign. We started by getting even more familiar with the products and looked at how other states were dealing with flavored tobacco products. This included looking at work from other states, including California, which was the first state to directly address e-cigarettes in a media campaign. I know Jenna showed the video from their Still Blowing Smoke campaign earlier today. And once we took a look at how other states and national campaigns were dealing with the issue, we figured out that most of them were focused on youth. And so that left an opening to talk to parents and educate them on these products. And we zeroed in from there on a target of parents of middle school and high school youth. So we hit the road to get their reactions to the products and learn what messages they responded to. So we did 6 focus groups across the state in Milwaukee, Rice Lake, and Wausau. So our focus group parents were not shy at all about voicing their opinion on these products. To say they were shocked was an understatement. Many of the parents were under the impression that they just needed to talk to their kids about not smoking. They didn't realize tobacco came in so many forms and flavors. And in addition to flavors, parents mentioned being worried about how easy to conceal the products were. Now keep in mind, this was before the big sort of Juul craze came on the scene. So what they were already saying, we're worried about how easy to conceal they are, and we know that that's only become more so the case over the course of the last 2 years. And one of the things that all the parents had in common was that they wanted a place to go where they could get straightforward information on this. We found that one of the big barriers to having a conversation in the home was that they were worried they were going to get schooled by their own children on it. So, hey, let's talk about this. Oh, Mom, Dad, you don't know what you're talking about. It's fine. So they were sort of scared about looking foolish or whatever with talking to their kids. So we really wanted to create a non-judgmental place where they could get the information about these products so they could start those conversations at home and in their community. So now I'll talk about how we use the insights from those focus groups to create the campaign. So after talking to Wisconsin parents, we realized the best person for them to hear the message from was another parent. We built Tobacco is Changing around the concept of a parent that's just as new to these products as our target audience. And we really thought that would help the message be more approachable. We didn't want parents to feel like they were being lectured or being talked down to. We wanted to start a conversation. Just like we want them to have the conversation in their home, in their communities, we wanted the media campaign to really be presented as a conversation, not as someone wagging their finger. We had 10 audition reels for who our spokesperson would be, and we wanted to really make sure that we found the right person that would really connect to people across the state. So we again went on the road with focus groups throughout Wisconsin, tested our different potential spokespeople. This is Marie Justice, who scored across the board, just scored off the charts, and so we knew we had someone that people would really respond to with the message. So now for the fun stuff, we can take a look at the campaign. So the name of the campaign is really simple and straightforward, and it really came from our conversations with parents, that tobacco is no longer about just cigarettes. We wanted to communicate that idea right from the get-go. And so from there, it was time to put the campaign together, and the primary component across which most of the campaign revolved were quick videos to educate parents about how tobacco is changing. The videos played in cinemas, on YouTube, and on social media and websites popular with parents. And so now I thought we could have some fun and take a quick look.
I don't know when tobacco started changing, but man, now tobacco comes in all these new sweet flavors. Grape, cotton candy, gummy bear? What? Tobacco's changing, parents. We've got to keep up. As a parent, I thought I knew what tobacco looked like. I had no idea. Now a dangerous nicotine addiction comes in all kinds of shapes and candy flavors. Tobacco's changing, parents. We've got to keep up. Here's a quick quiz, parents. Which hand is holding the tobacco products?
I'll stop her before she starts again. When they're only 15 seconds, they go pretty fast. So you can see that those were really about getting a quick hit there to really get parents' attention quickly and to introduce those ideas. And one of the things that you'll see as we go through more of the campaign creative is that it's really about trying to draw attention to not only the flavors, but the packaging as well. So like the officer was talking about this morning, it's being alert, it's being more tuned in, that it's not necessarily thinking about what you grew up with. You have to be more aware of how the landscape has changed. And so all the campaign materials direct the audience to tobaccoischanging.com. That's where parents can learn about the different types of tobacco products, as well as issues like flavors, packaging, and menthol. And once they're there, visitors can also use the website to connect with tobacco prevention and control coalitions in their area. This is our products page on the website, that just to give you a little sense. And this is something that we try to continue to update with new products. As Jenna said, it's sort of always a matter of, we're telling parents to be alert, we're telling teachers and school professionals to be alert, health professionals, but we also need to be alert too and try to keep up on these trends. But we really kept in mind the parent feedback that we heard in the original focus groups, that seeing is really believing with this. It's sort of one thing to talk about these products and sort of understand them intellectually, but it's another thing to really see them. So during our focus groups, we showed the products to parents, and that's when they got really upset. So it's one thing to sort of hear, there's flavors like bubble gum and grape. It's another thing to really be able to see them. And so we found that was really important, that parents be able to look through these, see what the different types of products are, and what some of the different concerns are that are connected with each of the different products. Another component of the campaign was billboards. We ran images like this one in Milwaukee and Superior. And one of the reasons we chose billboards to start was for their stopping power and their ability to get the people in the community talking. This is also a print ad that ran in the campaign, and this is another example of, again, it wasn't just a campaign about flavor. It's not just about a campaign about flavors. It's also a campaign about looks being deceiving. So this idea that the candy and the tobacco products look so similar that it can be hard to tell the difference. Social media also played a big role in the campaign. We promoted videos on Facebook, and we also ran organic posts. And the videos, what we found was that they proved to be really shareable. So that's what we saw more necessarily than comments, was that people just really wanted to pass this information along. We did see some sort of interesting trends in terms of who reacted what way on the different posts. So typically we saw that females were more likely to share the posts, but then we saw that males were more likely to comment on them, and usually not favorably. So just to be completely honest, so one of the things to be aware with in this is to really try to frame this issue in terms of how you want to talk about this. So for us and this campaign, this is really an issue about youth tobacco use. This is not an issue that at least for this was not about talking to adults about these behaviors. So always trying to keep that front and center, that we're saying parents, kids, always trying to include those types of buzzwords in the ads to really reinforce that idea as much as possible, because people can get very defensive about this issue. So as much as you can sort of frame the conversation as this is a prevention issue, we're not really getting into, I'll let other people like Alex talk about it from a cessation issue, but really trying to keep it on that prevention angle. So here's the funny thing. The campaign is called Tobacco is Changing. And so it was only appropriate that pretty soon after we launched the initial campaign that the Juul explosion happened. And it was pretty clear that we needed to get back out in the market and really acknowledge this huge piece of the puzzle that had come into play after the campaign was launched. So now I'm going to run through a couple of the new elements of that campaign. We re-entered the market with Tobacco is Changing in March. We're going to be out in the field until August. So I just want to show some of the ways that we've kept these new products front and center. So one of the things that we're doing with the campaign right now is really focusing in heavily on digital. That includes Pinterest advertising. So one of the interesting things, though, that we saw with Pinterest was that you can't actually show tobacco products on Pinterest. So we found sort of an interesting way around this by showing the products that the tobacco products resemble. And so you see here the flash drive, the mint tin, the eyedroppers, things like that, to give a sense of, even without showing the products, that they're not looking like what you would expect them to look like. Same type of thing here with our Facebook carousel ad. We really want to help familiarize parents with the new pod-based products that are hooking kids. And the ad is really designed to hammer home that point that tobacco products don't necessarily look like tobacco products anymore. We also made a big news media push with the relaunch of the campaign and have had some great success with that as well. You can see here that in one of these stories, that TV station did a poll of their Facebook followers, and only 50% of parents could say they could identify the e-cigarettes. So it's one thing to talk about Juul, it's another, or Soren, or any of the different products. And again, there's sort of the intellectually, yeah, I guess I understand that. I know they might look like a flash drive, but it's another thing to actually be able to say, yeah, I could recognize that that's an e-cigarette. So a few more examples here. So now I want to talk about ways that you can help us spread the message of the campaign. So the first is by following the Department of Health Services posts following the Department of Health Services and sharing their posts on tobacco is changing. The department posts on the campaign on both Facebook and Twitter. This is an example of one of the Facebook posts that we rolled out with the relaunch of the campaign. And you can see that we reused the Pinterest ad here, and we saw that this ad really connected with people. This was not a paid post. This was just a completely organic post. We had 564 shares, which was kind of crazy. I don't know if that's a DHS record, but I was pretty proud of it at the time. So just to give a sense of that, sometimes there are ways to get this message across without necessarily showing the products. And so again, keeping with that theme of tobacco is changing, addressing not only the different packaging and the different new forms of the tobacco, but also the flavors as well. So this is another one of our different ads. And one of the ways that we want people to promote this through social media is that we've provided profile and cover photos for Facebook and Twitter. So this is an example of one of those cover photos. And you'll see some that highlight the flavors, some that highlight the packaging. So this is another one of our cover photos. And this is one of our profile photos. So really trying to get that idea across that these are bright, these are colorful, these are shiny, these are new, they're not what you're used to. We also have a 2-minute video available called The Talk. That's something that goes into quite a bit more detail in 2.5 minutes. So while we showed the 15-second videos, those are really sort of to just quickly sort of get you curious about it and get you to the website. The talk walks you through the different types of tobacco products that are out there and some of the concerns that are with it. It's a really nice condensed way to introduce someone to this issue. And one of the things I do want to emphasize is that with e-cigarettes and the way that their popularity has gained so much momentum with youth, obviously they've had to take center stage with the campaign, but the campaign is really supposed to be about all other forms of tobacco products. So it does hit on candy flavored and fruit flavored little cigars and cigarillos, snus and chew, different things like that. So just to I just want to make that clear that it's not necessarily an e-cigarette campaign. E-cigarettes obviously have to be a big part of the conversation, but we are trying to look at tobacco as a whole. Another tool that we have available are web buttons. This is a little widget that can be placed on your website that can redirect your visitors to the Tobacco is Changing website. And this is actually from UWC-TREE's website, just an example of that. And with all of these, my contact information is at the end of the slide, and I have business cards too. So if you are interested in any of these different materials, please let me know, and I can provide them to you. I'd be happy to. We also have downloadable fact sheets that are available on tobaccouschanging.com. The 3 different fact sheets cover products, they cover issues like flavoring and menthol, and then they also provide an overview of the campaign as well. And in the tables that are out in the lobby, there are numerous copies of the different fact sheets, so I definitely would encourage you to pick those up and feel free to take more than one. We've also done a podcast episode with members of the Wisconsin Women's Health Foundation who do the First Breath program. This was myself and Marie Justice, who's our campaign spokesperson. And the really cool thing about this is that you can actually embed this onto your website, so people would not have to leave your website to listen to it. They could listen to it right then and there. But it's really sort of a chance to go into that deep dive. And the great thing about Marie is that in addition to just being a great personality, she is a mother as well. And so one of the things that was really cool as we did this campaign, first filming the ads and then added new materials to it, was that you really saw this go from beyond a job to her to really sort of understanding. I see sort of nodding heads here, and when I talk about this with parents, she's just like that, she was just like them. And so it really became sort of a passion for her as well, which was just a really awesome side effect of working with her and doing the campaign. Another thing that can be used from the campaign is right on the website. By going to the What You Can Do page, there's tips for talking to your kids, and those are designed for parents, but I think that they're also really transferable to educators or school staff as well. But again, just like the officer talked about, it's not about coming down on them. It's really just about starting that conversation, and don't be afraid to let it be a conversation. So just want to share some results that we've seen since the relaunch of the campaign. And one of the things that we've seen, and not surprisingly, is that by introducing some of the newer tobacco products in it, we've seen the campaign get some new life, and we've seen people really responding. So here are some of the things that we've seen since that March 4th launch, and we'll continue to keep monitoring. And one of the things that we have that works in our favor right now is that this is something that the media is really interested in. This is something that people are sort of geared into right now. So it's a good time to be talking about this. I feel like every day in my Google alerts, I'm getting stories about whether it's the FDA or Juul responding to something from the FDA. So this is something that's getting a lot of coverage, and this is something that people care about. So we should take advantage of that and make sure that we're getting our message across. So with that, I want to thank everybody. I'm always happy to talk about the campaign, and I'd also really be happy to answer any questions that folks might have. Thank you. Or you just want lunch. I get that too. Okay, thank you, everybody.
For just a few minutes. I promise I'll be brief because that is a tough spot to be in between lunch and a quick presentation. I really wanted to ask Spencer, I see he's wearing the W, but I know we're live, but I really want to know about what your thoughts are about the Hauser brothers moving to where they went. But that's after. We can talk about that. So I will be really brief. My name's Shrader. I'm the Vice President of Community Health for the Marshfield Clinic Health System, and I had hoped to do closing remarks, but I actually have to go back and take care of some things. So I just wanted to hijack the stage for a few minutes. I wanted to make sure that I personally was able to drive over here and thank our partners. Darcie, Carleigh, Spencer, Jenna, Frank, Alex, the Lincoln High School FACS students. What I find interesting is 18 years ago, I started my career in public health. I was with governmental public health for 10 years before I went to a health plan and then to the health system. And I started my career as a tobacco control specialist. And so I find it ironic that 18 years later, I stand in front of a bunch of people with a different title, still having conversations about tobacco control, specifically around youth. On a personal note, this is a topic that I find very near and dear. Not only do I have now a 13-year-old and a 7-year-old, conversations have shifted before, and really now it's about the difficulty sometimes of being a parent with children that age and dealing with and helping them understand different topics. So yesterday at the dinner table, I was talking with my 13-year-old about vaping and e-cigarettes, and it was a great conversation. But beyond that, it's really difficult to be a kid nowadays. You have technology, you have cyberbullying, you have issues around opioid, the list goes on, and now we're adding this new thing to it, which in yesterday's presentation in Eau Claire, I give kudos to Juul and other e-cigarette companies because they figured it out. They have an amazing business plan that speaks to our kids. Technology, this is the first generation that grew up that was with internet. So this is the first group. They're constantly connected, as I see most everyone else here is constantly connected. But they played right into that card. They played right into that card. And our challenge as individuals that are in public health is to try to figure out how to, play the game of David versus Goliath. Public health has been doing this for centuries, and in this case, it's a $44 billion industry versus $4 million in prevention funds. It's large marketing efforts versus Spencer. You're welcome. It's a lack of oversight. We want our FDA to do more and do it quickly, and now we have to wait a few years for that to kick into place. So it is a David versus Goliath. But one thing I know in my 10 years in public health is that people come together, and that's something that the vaping industry, those companies can never pull off. They can never put people in a room like this to try to address local issues. So I'm fairly confident, and our role as a health system is to do more, to be a better partner, to be out in the community, to invest where we can, to screen our patients better, to provide better patient education, to talk about cessation resources, and try to connect our patients to the community a little bit better. So with that in mind, one of those ways we can do it was this conversation. It was really a dialogue. We didn't anticipate a whole lot besides learning the landscape of what everyone's doing and trying to have conversations about what we can do better, how we can coordinate better. One of the things that we're committed to, and I'm happy to announce it today, is we want to have this conversation continue after the forum today. And we know that the best way that's going to happen is at a local level. And so we are putting out $20,000 in small catalyst dollars. And these catalyst dollars are really quite simple. We just want you to go back and continue to have conversations. And we know that's not free. We know when you print marketing materials and want to distribute them, that's not free. We know when you want to pull together stakeholders and maybe you want to provide a lunch as a way to get them there, that's not free. So these dollars are meant to do that. They're meant to pull people together and have conversations about what's next. What can we realistically do that aligns with our state efforts, our regional efforts, and our local efforts? And so those dollars are available. They'll be really, really simple because we don't want to put a lot of complexity behind some dollars. And so I think afterwards there'll be an evaluation that'll be sent out later. And with that, we'll put a link to our website where you can go in there and start thinking with your local partners about what can we do at a local level that enhances or supports something that we're already doing. So if anyone has any questions, I'm happy to take them. Yes.
I just want to make a comment about your David and Goliath. Using that as a, I'm sorry, I feel loud enough. The David and Goliath comment, could we use that to our benefit? And Goliath is the bully, okay, the tobacco companies, and people don't like that. And if we would put that out there for the people to understand that that's how they're targeting our youth, maybe we could get somewhere, because I know parents are protective and kids don't like being bullied either. And when we put it out there how they're targeting them, they don't like to hear that. And if we get our message out that way, I think that we might get somewhere. And I know it starts small, but it doesn't cost very much either to talk.
Right.
So that's what we're doing in Forest County.
That's awesome.
So,
Spencer, I think some of even your marketing materials may speak to that, or do you want to talk a little bit about that really quick? Because I do think there's value in a voice, right?
Yeah, absolutely. And I think one thing that we have on our side is truth, too. Not the youth tobacco prevention movement. I mean, literally the truth that their stock and trade is in selling lies and image and lifestyle, whereas what we are actually, one thing that we actually have on our side are facts and the truth, and I think that people do respond to that. So that's something that we're always trying to keep in mind as we develop new materials. Absolutely.
Any other questions or comments? Otherwise, you're still on time, so that's really cool. And lunch is breaking till 12:15, and lunch is in the adjoining room. The girls can direct you there. Otherwise, again, on behalf of the health system, we really appreciate you being here, and thank you.